As you know, many people experience acid reflux from time to time. So today's topic is gastroesophageal reflux disease, also known as Gerd. This occurs when the stomach acid frequently flows back into the esophagus, and this backwash can irritate the lining of your esophagus. And we can see it when the patient has burning sensation in the chest, usually after eating, which may be worse at night. Also regurgitation and the sensation of lump in your throat. I'm going to stop right here because today we have a special guest. So now, welcome Dr. Macias. It's a pleasure to have you here.
Hi, Dr. Gonzalez. Thank you for the invitation.
So the question, doctor, what is the cause of this disease?
Well, the principal cause is the constant acid reflux. Between the esophagus and stomach, we have a sphincter known as the lower esophageal sphincter that is responsible for not letting the acid from the stomach pass into the esophagus. So this pathology occurs because the sphincter relaxes and allows the acid up from the stomach to the esophagus. Also, we have different risk factors for GERD, such as obesity, folding of the top the stomach up into the diaphragm, hiatal hernia, pregnancy, connective tissue disorder, and delayed stomach emptying. On the other hand, we have factors that can aggravate the reflux. These include smoking, eating large or eating late at night, eating certain foods such as fatty or fried foods, drinking certain beverages such as alcohol or coffee, and taking certain medications such as aspirin.
Thank you so much, Dr. Macias. And Dr. Sanchez, it's nice to see you again. Welcome back.
Hello, Dr. Gonzalez, and thank you very much for the invitation.
The question, doctor, this disease has complications?
Yes, over time, chronic inflammation in the esophagus can cause three main complications: esophageal structure, esophageal ulcer, and barred esophagus. The first and esophageal structure were damaged to the lower part of the esophagus by stomach acid causes scar tissue to form that causes a narrowing of the alimentary canal and causes swallowing problems. The second is an esophageal ulcer, where stomach acid can wear down the esophagus tissue and causes an open sore to form that can bleed, cause pain, and make swallowing difficult. And the third is a barred esophagus, where acid damage can cause changes in the tissue that lines the lower part of the esophagus, presenting an increased risk of the esophageal cancer.
Very interesting, thank you. And last but not least, welcome Dr. Munguia.
Hi, Dr. Gonzalez. I really appreciate your invitation to this program.
The question, doctor, which is the treatment?
Well, lifestyle change, antacid, and proton pump inhibitors are the first-line treatment for GERD. Lifestyle change includes losing weight in overweight individuals and avoiding spicy, fatty foods, chocolate, coffee, and alcohol. Additionally, keeping the head elevated during sleep and not lying down immediately after a meal are recommended. And the medications include antacids, which neutralize acidity of gastric secretions, and proton pump inhibitors, as well as H2 receptor blockers, which decrease hydroelectric acid production in the first place. Other treatment is surgery, that can be done when pharmacological treatment is not effective. And the most common procedure is Nissen fundoplication, where the gastric fundus is wrapped around the lower esophageal sphincter in order to make it tighter.
Thank you, doctor, and I want to thank you all of you guys for being here. That's all for today. I really hope this video was interesting for you. Thank you, see you later.